The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Good evening, magandang gabi po sa inyong lahat. Naimbag Asardam, maayong gabi sa inyong lahat. Maraming salamat po sa inyong pakikinig sa aming programa, Healthy Mondays with AAPINA of Nevada, here at PHLV Radio. And I'm yours truly, Dr. Marife Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Here we are again on a Monday night. I really don't know how to begin. This topic that we have right now, it's very controversial, and there's so many things that we are going to talk about tonight about this topic. But first of all, I wanted to introduce my guests, who are my colleagues and friends. They are nurse educators here in the Southern Nevada. Welcome, Dr. Reimund Serafica to Healthy Mondays.
Good evening, Marife. Good evening, listeners. It's nice to be back here again at Healthy Mondays, and I'm excited to be here with you again.
And by the way, Dr. Reimund Serafica is our current president for the AAPINA of Nevada. And thank you for being here tonight with me. And our second guest, and who's going to be giving us a lot of information about our topic, is Dr. Katherina Fontanilla. Please introduce yourself.
Good evening. I'm Katherina Fontanilla. I am currently the treasurer for the AAPINA of Nevada, and I am also a professor at the College of Southern Nevada. And thank you for having me.
Thank you, Kay. So our listeners out there, all three of us are nurse educators, and so we're going to share with you some of the things that we actually teach our nursing students. But you all know, it's known that nursing is the number one most trusted profession in the healthcare. So we will start with how do we educate our nursing students in regards to medication administration. So we can start with Kay. Kay, can you share with us like a day in the life of Dr. Kay Fontanilla when you're taking students, or even I think in skills lab and simulation, right, and didactic, and then it extends to the clinical setting. So what happens? What is the day in the life of Dr. Fontanilla?
Well, of course, it's a lot of preparation, and I always review, all these initiatives. Being here, I just also want to tell you that it's the topic today. It's relevant to what I'm teaching. I teach pharmacology, and I also teach lab. I also teach in the clinical setting. So everything is applied. Everything that I teach the students will apply in the lab, and they will apply in the clinical. So a lot of preparation, a lot of reinforcement regarding quality and safety in terms of administering medications to our patients, because most of the time, even the most educated patient, they are like really vulnerable, and they lack information regarding the safety of the treatments that are being administered to them. So a lot of reinforcement to our students to make sure that we are educating our patients regarding the treatments that they are getting.
Yes, I know the magic 6, right? The 6 rights in
Correct.
medication administration.
Yes.
Well, Dr. Reimund Serafica, Ray, in your side of the wood, or what is it?
Well, I would agree with Kay. When a student enters nursing school, they were given a basic pharmacology course, and what it entails is like they were given, before you can even give the medications, you need to know all the rights, and you mentioned it before. Is it the right patient? Is it the right drug? Is it the correct time to give the medication, the dose and the route, and also, are you giving the medication for the right reason? And sometimes that comes with clinical judgment, with critical thinking, and we train our nurses, our nursing students earlier on, to always have that in their mind whenever they pull the medication out of the pyxis. And it comes with the patient education, with the documentation, and also check the expiration date is one of the things that we train them to do. And also, if the patient, for example, refuse the medication, then what kind of documentation and what further steps that you need to do, in order to whether you call the physician or you report it to your charge nurse. So we need to do something to complete the process. So it's not just like you're just gonna stop and move on. There's always this pause. Joint Commission is very big on pause, and I think we can talk more about that later on. There is the medication review, there is the medication reconciliation. We have to check whether was this drug going to affect the other drug that the patient is taking. So those are basic knowledge that we give the students on during their training. And of course, when we take them to the clinical setting, then we see the application and we see the practice that these principles are being followed.
And I'm really glad that you mentioned about the right to refuse. That's often overlooked when we educate our nursing students, and emphasizing patients' right. Just because the doctor ordered it, just because the pharmacist filled it up, and just because the nurses is giving it to the patient, doesn't mean that you should give it to the patient. And not only stopping right there that they refuse and document it, also take one more step to ask them what could be the potential reason, or what could be the reason why they don't want to take the medication. And a lot of times, and Kay mentioned it's lack of knowledge about the medication itself and what it does, or maybe there's myths about certain medication. If I take it, I'm going to have polymyositis. Remember the one of the statins for the to bring down your cholesterol. So I think that we owe it to our patients to take another 1 or 2 step back and say, oh, my patient is refusing the medication. I'll document it, but I wanted to know why. Is there something that I could do to educate this patient and family that this patient really needs to take this medication in order to address the reason why the patient came into the hospital? An example for me is when I was at St. Francis Medical Center in Honolulu, where there's this elderly Japanese who refused to administer his insulin. And I could just say, like, if you don't administer the insulin at home setting, you could die from severe hyperglycemia, right? But instead of saying that, I said, the next visit, please bring your daughter who lives with you, and please bring your wife who's there to help you. And guess what? With just taking that time to look into why he's refusing the medication and the treatment, it's because he couldn't see the calibration. The wife is, and I said, oh, maybe the wife can prepare it for you, and she will be there to give you the insulin, and you can administer it yourself. And then the daughter who works during the day can verify the calibration and the doses on the prepared insulin. So if we only take that extra time to figure out, why is this patient refusing the medication? Why is this patient refusing the treatment? I think that's one practice that we often overlook. I guess the big question tonight, we'll dive into the real topic that we are here for tonight. What happens to a nurse who makes a medication error? So according to the literature, these are the consequences for the nurse who makes a medication error. For a nurse who makes a medication error, consequences may include disciplinary action by the State Board of Nursing. You can even be fired, job dismissal, depending on the extent of the medication error. And also, it also inflicts mental anguish for the nurse, because who among the nurses who would want to harm their patient, right? And also the possible civil or criminal charges. So I'm going to just dive right into the topic that we have. This is according to the NPR News, dated March 25th, 2022. And some of this I'm going to read verbatim. So this is the nurse convicted of neglect and negligent homicide for fatal drug error. And I think I'm reading this and giving a synopsis for all our listeners out there who have not heard this in the news or seen the litigation. This is a former nurse found guilty in accidental injection death of a 75-year-old patient. And her name is Redonda Vaught. And she's a former nurse criminally prosecuted for a fatal drug error in 2017. And she was convicted of gross neglect of an impaired adult and negligent homicide after a 3-day trial in Nashville, Tennessee. And she is now facing 3 to 6 years in prison for neglect and 1 to 2 years of negligent homicide as a dependent with no prior convictions. She's according to the sentencing guidelines provided by the Nashville District Attorney's Office. And she is Vaught, her last name. She's scheduled to be sentenced in May 13, which is fast approaching, and her sentence are likely to run concurrently, according to the attorney's spokesperson. So this nurse, who had been working for many years, was stripped of her nursing license and is now on trial for Nashville for these charges of reckless homicide and abuse of impaired adult. And again, if she's convicted, she's going to face as much as 12 years in prison. And I guess I can start right here. Maybe, Ray, you can follow up with what are your thoughts about this conviction for a nurse who had been working for many years.
Thank you, Marife. So it's really disheartening to hear this news. You know, as a nurse myself, you know, I can only empathize with Redonda and what she's going through. You know, with this medication error trial. There's a lot of things that came to my mind when I heard about it. Like I question her knowledge. It's one thing. I question the environment where she was in during the time of error. I question the hospital system and how are they supporting her or not supporting her. I also question the people around her when she was working at that time. She did the right thing of coming, because you see multiple versions of the report, but most of the reports were saying that she did report the error, and that's one basic teaching principles that we do in school. Like, you know, when you made an error, you have to come forward and you have to report it so they can do further investigation. They can do an FE, what do you call that, in quality improvement process, where they can reinvestigate
root cause analysis, yes.
And where they can reinvestigate where the error came from. So in case of Redonda, she's not the only one. Errors are made every year or every day, but then the big thing that came out of this is when she pulled the medication that she's supposed to give to the patient, there were some system errors there to start with. First of all, she pulled out the wrong medication. She probably did not check and see whether this is the medication that she needed for the patient. So when you talk about knowledge, you know, we always teach our students, if you are not familiar with the drug that you are administering, go and look it up. You know, there are resources around you that will verify whether you understand this medication. And it dawned on me too when this happened that medication error does not discriminate. Even a seasoned nurse can have this kind of error. And knowing Redonda, you know, because a lot of stories came out of this, you know, she has her BSN from a very good university. She's been an ICU nurse. She's also a charge nurse. She did leadership roles in the hospital. So she's not brand new at all. But it makes you wonder what happened during that time, and when she committed that error. What was she thinking, and what is really the situation involving that.
What's the scenario, right? And I know, Kay, as a nurse educator, you know, when we're training our nursing students, we check them 3 times, right?
Yes.
The first time is when you look at the orders, what are the medications that I need to give at 8 o'clock and at 10 o'clock? And then you go and check it. We have the students check, you know, what is the indication of the medication? What are the doses? We go through the 6 rights, you know, the correct patient, the correct time of administration, dose, route, the indications, and what do you need to do before, during, and after you administer it. Then that's one check. The second check is when you're actually taking it out from the medication, right? Then maybe you can walk us through the 3 checks.
Well, of course, it's because you want to make sure that we are getting the accurate information or accurate data. But not only, of course, from the procurement of the order, it means this is appropriate for the patient when the prescriber has decided that this will be the medication that is appropriate for the symptoms that this patient is showing. As nurses who are practicing and are the ones delivering those medications, you have to do the 3 checks, and that's what the book says, and that's what the guidelines will say also. But we have our own decisions also, because we are the ones in front of the patient, and we are not going to neglect, you know, the fact that we have to check them. We have to still check the appropriateness of the medication. And again, the 3 checks. After the 3 checks, you want to assess the patient. You want to assess if the patient truly needs that. And when you administer the medication, you want to assess what the response of the medication, what the response of the patient is on that medication. And afterwards, did that take place during that moment when the alleged nurse was taking care of that patient? And as I was reviewing and viewing the court hearing at that time, it was noted that when the medication was administered, the nurse did not stay with the patient. So we already missed a check on that one. That is reinforced to the students. You know, we all know that as educators. We always tell them, stay with the patient, especially if it's a high alert medication. Another thing that I have noticed also was, as a high alert medication, there was not another licensed practitioner to sign off that medication when that medication was administered.
The verification, 2 RN verification.
2 RN,
Yes.
or 2 licensed nurse
Yes.
verification. So I think this is an eye-opener, not just for nurses, but for everybody in the
For
medical
everybody.
field. Because, I don't know, there probably is a judicial problem as well with, because they're not nurses, they're in the legal field. So I think this is an eye-opener for everybody. And even the general public, I would say, we have the initiative Speak Up, you know, as patients, let's say, who are not in the medical field, we want to let them know that they have to advocate for themselves, you know, not just receive medications, have themselves be informed also.
Be knowledgeable about what the
knowledgeable.
medication is being given to them. Be knowledgeable about what the side effects as well,
True.
and ask questions.
And
ask
I
questions.
like the
Right.
fact that you also mentioned regarding involving family members. Have a family member advocate for the patient, especially in an event where they are impaired because of medications or a disease process that they're afflicted with. That way, you know, they can question the medications being administered to the individual and prevent medication errors. They are preventable, supposedly, but
Yeah.
you know, it's still
There's no such thing as perfect situation, right?
yeah, and there's no such thing
Yeah.
as there's no such person as a perfect nurse, you know, something like that.
Correct. And as you're talking about, I think there's this concept that I teach my student, the Swiss cheese concept. If you look at the Swiss cheese, what do you see? They're holes. And so as healthcare provider members, we need to cover the holes. So it starts with the provider, the doctor. It could be a nurse practitioner or a medical doctor or anybody who's prescribing the medication. And somebody has to look at it, is correct. And usually when the physician writing the order or type it in the computer system, it goes to the pharmacy, right?
Yes.
And the pharmacies look at it, look at the medication itself, look at why it's being ordered, and the doses itself. Because I ask my students, what is the normal range for doses for this? If it is over the range, you question is, why are you giving more than what's recommended for this particular medication twice a day or once a day or 3 times a day? So if the pharmacist catch that error, he covers one hole, but there's a lot more holes that's in that piece of Swiss cheese, right? So then the physician writes it, the pharmacist missed the hole, and then it goes to the nurses. So the nurses has to double check it and even question it, because we are equal partners in the healthcare team. And if the nurse did not cover that hole and gave that medication, that's why Nurse Vaught, or former Nurse Vaught, is the one who is taking the responsibility, because she's the one who actually gave the medication to the patient. And so I wanted to share about the founder of the Show Me Your Stethoscope, Janie Harvey Garner. The Show Me Your Stethoscope is a nursing group on Facebook with more than 600,000 members, and they shared about their worry about the conviction that it will have a chilling effect on nurses disclosing their own errors or near errors, and which could have a detrimental effect on the quality of patient care. And we talked about earlier, before we started the episode, about culture of safety. Maybe I can ask Ray to expound more on what do we mean by culture of safety in the nursing profession and the healthcare profession?
So when they talk about just culture, in most health organization, this is like when a healthcare professional, when they make a mistake or they have a near miss, to report it. And once they report it, then there will be no punishment for that. And what I was saying earlier, they have to retrace their steps. Where did they make that mistake to get it better? That is the reason why, they're pushing for that just culture environment in every healthcare organization. So nurses or any healthcare professional, for that matter, will be honest and will not fear that they have to hide an error. They need to report it to be more transparent, and then steps can be taken to make sure that it will not happen again. And I just want to share something. It dawned on me, Marife, and it's going to be really quick. When I was new nurse in ICU, I was following a seasoned nurse. It's end of shift. I was coming in as a night shift. There was a day shift, and when I went into my patient's room, I saw a heparin bag that's almost empty. So I quickly asked the nurse, said, "Oh, heparin is already finished. What are you supposed to do with the order, or what are we doing with this one?" And her face just went white, because you know what? It's not supposed to be heparin. It's supposed to be Hespan. And the patient's initially the patient's blood pressure is going down. So of course the doctor ordered a Hespan. Hespan we know is a volume expander that will help with the blood pressure. Heparin is a blood thinner. So the peak says, yes.
Right?
So the peak says when you type in HE, heparin, Hespan, it will open up at the same layer. The two bags are on similar location. So she grabbed the heparin and hang it, bolus it for $9.99.
Wow.
And then when it beeped, she did it again because the order was 2 bags. She went back to the Pyxis and got the second bag, another heparin bolus.
That's
2
an
times.
example of a systemic failure.
Yes, yes.
Systemic failure. I think that our advanced technology is supposed to help us to cover the hole in the Swiss cheese, right?
Right.
But sometimes it's go against us, and we became complacent with the system. That remember the 3 checks, and I don't think the nurses who have been working as nurses would do the 3 checks as we have been teaching our students,
Yes.
because they already know the process. They already know it. But when we start making shortcuts, that's when we fail the system, or the system failed us. So I guess that's the thinking about that. And I think that there's talks about after this verdict of this nurse, healthcare just changed forever, because the nurses can no longer trust people to tell the truth, because they will be incriminating themselves.
And again, that affects the whole just cultures, thing that we're pushing, and it makes it can implicate to nurses now. And we heard these reports that they are planning to leave the profession just because of this, or even it affects our nursing students. Should I continue, because this is what's going to happen to me each time I make a mistake? I can go to jail, right?
And you're working so hard to study to pass the exams and to graduate from the nursing program and pass the nursing boards. And I think our listeners out there who is not familiar with the process. Before you become a nurse, you have to go through the nursing school. You have to pass all the exams. And I'm gonna advertise Roseman University. We require 90% passing rate, and then also you have to graduate from the program in order for you to sit on the NCLEX RN board exam. And after you pass it, you have to pass another certification or whatever the hospital or your potential employer is requiring of you. And I think that. What really bothers me is that the neurologist from Vanderbilt, Dr. Eli Zimmerman, testified that it was in the realm of possibility that Murphy's death, that's the patient who died, that the death of the patient was caused entirely by her brain injury. And then the Davidson County Chief Medical Examiner Feng Lee testified that although he determined Murphy died from vacuronium, he couldn't verify how much of the drug she actually received, and that Lee said a small dose may not have been lethal. So there's a lot of controversy here. But the bottom line is there was a medication error that happened, and that it was determined that it caused the death of this patient. And I think it's a rude awakening for all
Yes.
practicing nurses.
Yes. And even my NP students, when I teach them drugs for mental health, you can easily prescribe buspirone over bupropion, which is like two different.
Sound alike, look alike.
Yes.
Yeah.
So even patients get really confused about that. One is for ADHD with depression. The other one is for anxiety. And sometimes they can use it for blood pressure. But again, those little things that we really need to pay attention. And I know students who are listening, probably they get so tired of us reminding them of everything that, although, and say, why do I have to do it again? Why do I have to do this again? Well, there is really a purpose, because we are training you not to commit errors. And we're not only talking about medication errors. Sometimes simple questions like, do you have an allergy, or what are your allergies? It is giving us the whole story about that patient already. Or are you pregnant? When is your last menstrual period? Those are pertinent questions that if you don't ask the patients, you will probably fail as a practitioner. Because you may probably prescribe drugs, or you may probably pull another drugs in the pixes that may not benefit the patient, or may damage the patient even more.
The bottom line is patient safety.
Correct.
And do you guys remember when we were told now that for the NCLEX, the National Board Exam for Nurses, the NCLEX is now not going to use the brand name
Yes.
in the
Yes.
exam. They're now going to use generic name.
And I
It's-
think that's safer
Yeah.
Yes.
route to go.
And we can hardly pronounce some of them.
I know, right?
Yeah.
Yeah.
Wow, time flies when we're having fun. So we talk about the generic, we talk about the implication. How, one episode is not really enough to talk about this. And can you imagine, it's almost the end of April, and May 13 is fast approaching. That is when she's going to be sentenced. So I just wanted to, for those who are not familiar with the case, Vaunt, the nurse herself, who is facing this litigation and going to be sentenced, she said to the nursing board, I know the reason this patient is no longer here is because of me. And she started crying. So, and that, I'm going to cry. There won't be, I wanted to cry because she had worked all her life. I'm sure, she went through the challenges of all of our nursing students, and, the celebration of passing or celebration of completing the nursing program and passing the board. And now, fast forward with many years that she dedicated herself as a nurse, and this is what's happening to her. And she said, there won't ever be a day that goes by that I don't think about what I did. So profound, and it just, my heart breaks for her. So it could have been you, it could have been you, it could have been
She
me.
represents us.
Yes.
Yeah, she does. She represents all the passionate nurses who just wanted to take care of the patient and get them well and get them back home. So I guess words of wisdom. I always ask my colleagues about words of wisdom. Maybe Kay, you wanted to share some words of wisdom to our listeners out there.
Yes, for those caregivers who are responsible in, or the role is administering medications, make sure that you are doing the checks. And then for the patients out there, and that is going to be the general public, because everybody in the community must have been taking medications. Try to get information regarding what you are getting. Question what is being administered to you, because who else will do that for you, right? So it's yourself, or assign somebody who will do that, who will advocate for you.
Ray?
Yes. So I'm just gonna read an excerpt from the ANA, which is the American Nurses Association, when they released the statement after when they found about this case. I'm just gonna read few of their statements. They said the nursing profession is already extremely short-staffed, strained, and facing immense pressure. An unfortunate multi-year trend that was further exacerbated by the effects of the pandemic. This ruling will have a long-lasting negative impact on the profession. And like many nurses who have been monitoring this case closely, we were hopeful for a different outcome. It is really a sad day for all those who are involved and the families impacted by this tragedy, and it's sad for the nurses as well. So again, my dear students who are listening, clinical judgment, critical thinking, patient safety, and quality of care. Those are the things that we always have to think about each time we enter or if we have an encounter with a patient.
And take your instinct seriously.
Correct.
If there's any doubt at all, pause. You mentioned about the pause. Stop and look at the different angle. And a good critical thinker is looking at the situation. We don't know about the case scenario. We have seen really, especially when there's full moon, in the ER. We've seen all this happening. It's like a comedy sometimes. And
we can do a show about full moon.
we don't know what the case scenario is. But she represents us, really. And it's just heartbreaking to see this happening. We do take our role seriously as professional nurses. And again, no one is perfect. It just so happened that this happened to her. So I think, prayers for her that she will overcome this as a challenge. There must be a reason why, but whatever it is, it's just give her strength to overcome this. But I wanted to thank both of you, Kay and Ray, for being my panel members tonight and sharing with the thoughts and what we do as nurses, nurse educators. And of course, PHLB Radio, Johan and Flora, thank you so much for providing us this platform to share information to our listeners out there. As Kay mentioned, take initiative. Get yourself more knowledgeable about the medication, about the treatment that someone is telling you to take, and someone is telling you that they wanted to give to you. I recently fractured my right great toe, and I didn't want to go on surgery. I just want to make sure that I don't need surgery. So I showed everybody my x-ray. So be a wise consumer of healthcare services. So with having said that, thank you so much for listening to us. And remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.